Moving on, according to a Lancet study, more than half of the COVID survivors show at least one symptom, even after 2 years of infection. One of the symptoms that these people complain of includes fatigue, shortness of breath, and sleep difficulties. The study said that although physical and mental health have improved over time, but COVID patients still tend to have poorer health. This is especially the case for those who were infected with long COVID. The research followed 1,192 participants in China infected with COVID during the first phase of the pandemic in 2020.
Well, the study is based on the patients in China where the coronavirus was first detected. And after, in this particular study, it has in fact been found that though at least half of the people who are admitted in the hospital due to the COVID-19 have shown serious COVID symptoms, which include one of such symptoms, which includes shortness of breath, sleeping difficulty, fatigue. That is something that they will in fact experience for at least for 2 years since they have tested positive for COVID. Now, the findings also have indicated that for a certain proportion of the hospitalized COVID-19 survivors, they may have a clear initial infection, but more than 3 years is needed for a recovery, for a full recovery in a patient. So when on the onset, when you see that there are symptoms like there are in fact headache, body temperature, that is something that you go through when you are tested positive. But even the long-term infection, the long-term like the shortness of breath, fatigue, body pain is something that you will experience for the next 2 years. This is found in most of the patients is what the study is saying, while there are also people who might not experience such a long-term impact.
All right, so this is the latest as far as long COVID is concerned. The Lancet study says that at least one symptom still persists for those who have gotten the infection, those who've gotten COVID, and COVID survivors have poorer health. The Lancet study also says that symptoms like fatigue, shortness of breath, or sleep difficulties are being experienced by people who have been infected with COVID. The Lancet study also says that the study findings indicate that there is an urgent need to explore the pathogenesis of long COVID and develop effective interventions to reduce the risk of long COVID. Remember, this is the longest and the most intensive follow-up on long COVID. For more on this, I am joined by Dr. Suneela Garg, who is a member of Lancet Commission COVID India Task Force. Ms. Garg, thank you for making time and speaking to us on this very crucial issue. Long COVID has been a part of our conversations ever since the second wave of COVID swept through the world. Now, this Lancet study makes a lot of important points. One of them being is that some of the symptoms persist even after 2 years of those who've gotten COVID. And it also says that there is an urgent need to develop effective interventions to reduce the risk of long COVID. What is your take on this study?
First of all, thank you so much for having me on the show. And it's always been interesting, these relevant issues on this point of time at Mirror Now. And I like to say that basically, when we look at now, post-COVID symptoms, and now a lot of studies are on which are looking at the post-COVID symptoms. And this is one of the longest studies which has followed for the individuals for long period of time. And what it has been observed is that, the study observed the immediate and also the long-term COVID symptoms. So the important takeaway message is that we have learned a lot from this novel virus. The symptoms do not subside with the subsiding of infections. And we have any symptom, if you talk from head to toe, we have a lot of symptoms, starting from fogging, clouding and all that. But it has been observed by this study that respiratory symptoms, they last for a longer period of time. But other studies do have observed also that whether it is brain fogging or it is breathlessness or weakness, along with many other things, cardiovascular system, they stay for a longer period of time. The need of the hour is that in Indian setting, we need to have in every district a post-COVID clinic where these patients need to be followed up. But along with that, there is a sensitization which needs to be created. Right now, I do have a study also, which is being carried out in the community setting. But most important is that people need to be made aware of. within the hospital setting also and outside the hospital setting also, that when the patients are having, ventilation, or they're having longer, inpatient stays and all that, and they're intubated and all. So these symptoms, they tend to persist longer in those individuals. So it is important that before these patients are discharged, they're discharged, with the thing that they must come for, with the advice. They should come for follow-up, at the regular intervals, number one. Number two is that there is a need for intense counseling also for these individuals. But then again, lot of things, other things also, that is what we call them as non-medical interventions, do help. First of all, like I'll say that yoga, meditation, and all deep breathing exercises, they do play a very important role. But then here comes the link between the hospital and the community. That's where our frontline workers have got a very critical role to play. But the need of the hour is that we should not ignore any symptom following the patient being discharged, or, whether he has not even reported to the hospital. That is where we need to look at, post-COVID symptoms in a very, very, correct perspective, and take the symptoms, from the perspective of the client or the patient, so that, we can come out with correct observations. But my take on this is that these symptoms are being observed. Longer the period of hospitalization, longer are the symptoms as well. So it is important that we need to look at this very, very carefully. The virus being novel, symptoms are all, the post-COVID symptoms are also novel. So not only acute, but post-COVID. It's a long study which has brought out that even post 2 years also we are observing the symptoms. So you see, these could have been curtailed primarily if the patient is discharged with the correct advice. What does it mean for the client after discharge? How long is he supposed to, carry on with this post-follow-up visits? And we need to have it, as I've been pointing out repeatedly, at every district, the post-COVID clinics are required.
All right. Dr. Garg, one more question, which is not related to long COVID, but I wanted to understand from you that the relief that has been given to people who are flying abroad as far as the booster dose is concerned, how do you view that development? Do you think it should be, the rule should be implemented across the board for all people sooner than later?
See, that means basically I feel that in Indian settings, we have already had 3 waves of infection, right? And the third, because of Omicron, what we call it as variant of concern, has served as variant of support. And most of the people have got infection also, and people even after getting boosters are also getting infected. So it is important that basically we need to trust on the natural source of infection along with the 2 primary doses. These are sufficient from my perspective, from a public health point of view. So we should not insist that everybody should take booster, because we know the extent of infection which has taken place in Indian population. So I feel that this kind of a rebate has got to be given. And also you need to see that today's article also said that natural immunity accounts for 10 to 12 times of the booster doses also. So from a public health perspective, we need to look at it from this direction as well. And I feel that it's one world, one health. The countries which have not had access to vaccination at all, we should be giving vaccination to those countries, so that everyone has it's a question of equitable distribution as well. And also there is a need to relook at the vaccine, because now whatever vaccines we have got, they're against the original Wuhan strain. So the pharma companies need to have a relook at the vaccine, so that we come out with the latest type of vaccines which are going to be effective against the current strain as well.
All right. Thank you so much, Dr. Suneela Garg, for your valuable time and your insights on these crucial issues like long COVID and booster dose.